Results of grade 3 gynecomastia. Hello friends, I am Dr. Ankit Gupta and I am a plastic surgeon. I practice in Pitampura, Delhi, and I have my own center by the name of Panache Aesthetics, and we usually operate a lot of cases of gynecomastia or male boobs. So today I'll be showing you a patient who had grade 3 gynecomastia and I'll show you his results on table. So what exactly is gynecomastia? Gynecomastia or male boobs is nothing but accumulation of fat and gland on the chest of a male. Gyneco is female and mastia is breast, so female like breast being developed on the chest. So many a times we get a question, is it fat, is it gland? So it doesn't really matter if it is fat or gland. Yes, if it is fat, you can reduce your weight, you can do a lot of dieting and exercise and you can get rid of the fat and your chest swelling will go away. If it is gland, it will not disappear with your exercise and diet. If you had taken steroids, if you have taken anabolics, if you have taken some supplements, usually it is a lot of gland. So if you see a female breast, it is comprised of both fat as well as gland. So together they form a breast. The purpose of this surgery is only cosmetic. So what happens is you have a large swelling on your chest. No guy would like to have a swelling on his chest, and that is why they would come to me to get this removed. What I prefer to do is, I prefer to do larger gynecomastias under general anesthesia because there is a lot of fat. It is impossible to remove this fat under local anesthesia. If I am doing it under local anesthesia, I prefer patients only of grade 1 or 2A because in those cases there is a gland but the swelling is a little bit less and I don't have to do a lot of contouring of the chest. If I have to do a proper contouring of the chest, if I have to give you a good shape of your chest, if I have to remove all the fat from below on the sides as well as the axillary tail, I need general anesthesia because otherwise there will be an overdose of local anesthesia and that is very risky. So under general anesthesia, I prefer to do a liposuction for the fat and then through a very teeny tiny cut below your areola, I prefer to remove the glands. And as you can see on table itself, this is how you look. This is how your chest is. This is how, or this is what you had dreamt of to get rid of all this chest, all the fat that is there on your chest. I understand no male would like to have this fat or this swelling on his chest. Nobody wants that people should be shaming them or they should be criticizing them because of the chest. It should not hamper your brain that you cannot wear tight t-shirts or you are feeling guilty of removing your t-shirts in front of other people. If you face this issue, if it is psychologically affecting your brain, there is a very simple solution to it. You can always get rid of it. It is very safe, effective. It's almost 100% that we will be able to take off all the fat from your chest. We'll be able to take off all the gland and it will give you a very nice result and does not leave much scarring as well. And after about 3 to 6 months, nobody is even able to find out that you underwent this surgery. So if in case you are suffering from gynecomastia, if in case you are so stressed about the chest fat that you have developed, you can always contact our team and we'll be happy to help you. Thank you and have a nice day.